Welcome to this short narrated slideshow delivered by Southampton's Specialist Met Hub on behalf of Hampshire, Isle of Wight, Portsmouth and Southampton's Safeguarding Partnerships. This presentation is designed to be used as an aid for professionals completing the CERAF. The CERAF, now used across all 4 local authorities in Hampshire, has been adapted from Barnardo's Child Sexual Exploitation tool and now also includes indicators specific to child criminal exploitation and reflects local authority procedural differences. From September 2020, the CERAF started to be used across all 4 local authority areas in Hampshire, enabling a streamlined response across the county. We're going to look at some best practice guidance on completing the CERAF, scoring and subsequent actions, and touch on other tools available. It's important that a CERAF is completed as soon as any potential concerns regarding child exploitation are identified. This could be following a missing episode, a change of peer group, or an arrest for a drug-related offence. There are many indicators of child exploitation, and it's important to note that whilst some are more common, there's no definitive list, and with many local authorities using various screening tools, there's a diverse range of indicators being used across England and Wales to identify child exploitation. We also know that the way that children are groomed and exploited changes rapidly, and this is why we continually ask you to use your professional judgment. The CERAF can be completed by any professional working with children and is most effective when co-produced with other professionals and involving both the parent, carer and the child themselves. The CERAF not only helps to identify exploitation, but it's a guide to effective interventions, and so it should be considered a live document rather than a tick box exercise. The CERAF should be reviewed every 3 months or following a significant incident or change of circumstances. And it's really important as professionals, as I previously said, that we use our own judgment and that we're mindful of our use of language. Following completion of the beginning of the CERAF, which asks you to add the child's details and your own details, you will come to the first section of indicators, which is the low risk indicators or vulnerabilities. So in this section, we're asking you to think about whether these factors have increased the child's vulnerability to exploitation. The CERAF guidance that's available gives you really useful areas to think about for each different vulnerability. So for example, in breakdown of family relationships, it asks you to think about whether a breakdown may have caused the child to avoid going home or seeking a sense of belonging elsewhere. There's no time frame included here because we're asking you to consider each factor and their relationship with the child's vulnerability, as opposed to whether it exists now. Each vulnerability has a score of 1. The next section is medium risk indicators, and this section of the CERAF includes indicators that are associated with the risk of or that may indicate abuse through sexual or criminal exploitation. You'll notice that there's a time frame, and we ask you to only tick these if they've been present during the past 3 months or are current now. Again, the CERAF guidance has areas to think about for each indicator, and it is really useful to refer to these throughout. So, for example, when we look at regularly staying out, we ask whether the child's demonstrating a pattern of staying out late, or if there's been a recent change. Perhaps they're just pushing boundaries, or is it indicative of something slightly more concerning? Another example to think about is drug and alcohol misuse, and considering whether their substance use is beyond more common teenage experimentation. Are drugs and alcohol being supplied to the child as part of the grooming process? And does the substance given reduce the child's capacity to keep safe? Underneath this box is an area for you to give evidence of the medium risk indicators, and we ask that you include evidence for each indicator that you tick and as much information as possible. So to expand on the example of drug and alcohol use, we might ask you to think about how the child is accessing or funding the substance, who is supplying it to them, are there indications of dependency or increasing dependency, and could they be accruing a debt? It would be useful to have an indication of all the substances that are being used, And remember that this particular area is about the child's indicators as opposed to substance use within the family. The next area of the CERAF to complete is the high risk indicators. So these indicators have been selected because they're prevalent in cases where children and young people are at risk of or are being abused through sexual criminal exploitation. In order to monitor change in risk over time, either as a result of intervention or a change in circumstances, it's important to know whether the risk indicator is current or recent. And that's why there are 2 boxes beside each indicator, one for if it's been present between 3 and 6 months ago, and one if the indicator is still present now. So you can tick either box, or you can tick both. So for each indicator, there will be a maximum score of 6. So the guidance again is really useful to refer to, as with every other area, it breaks down each indicator, asking you to consider certain things to help you complete this as effectively as possible. So when we look, for example, at periods of going missing overnight or longer, it asks you to think about details of when and what is known about who they've stayed with. You're asked to think about whether they've been travelling out of area, found in another area with no obvious link, because this could be indicative of county lines risks and trafficking. And it's also important to provide details of how often this has occurred and the duration of missing periods, as well as any other known details. So it may be that there are occasions when a child goes missing overnight and it's completely unrelated to exploitation. However, it is probably still quite appropriate to include this within the CERAF, because it's always important to consider it as an indication of exploitation. As with the medium risk indicators, there's another box underneath this CERAF, and this box is easily expanded, so you can put as much evidence in as possible. And so for each indicator that you've ticked, please do ensure that you add as much information. And one of the really important things within this is, even though we have ticked whether they're present between 3 and 6 months ago or present now, to include dates is really crucial on building that picture of what that child might be experiencing. Once you have collected all the information you need from multiple sources and completed the low, medium and high risk indicators, ensuring that you've provided as much evidence as possible in the boxes underneath, you are ready to move to the next part of the assessment. Here you will consider protective factors and strengths, as well as safety measures and disruption. The presence of protective factors may reduce the level of concern about current risks. Conversely, a lack of these may heighten the concern. You may think about whether the child has any positive relationships with protective adults or supporting professionals, or whether they have positive and pro-social peer relationships or sustained access to diversionary activities. There may be some ongoing work with the parents and effective parental oversight, and there could be some community or police action that disrupts some of the risks. You are then asked to consider both the child's and the parent carer's views and perception of the risks. When there is a potential perceived risk of exploitation, conversations with both the child and their parent carer should take place to explore this. It's acknowledged that these discussions can be challenging, but it is crucial that they take place and are recorded. While some children may respond positively to the physical form, others will not, and it is acceptable to reference concerns and the CERAF and record their views from conversations rather than expect them to complete the CERAF alongside you. Gathering the child's and the parent carer's views adds context to any concerns and enables professionals to understand the impact that those views may have on the child's overall safety. Does the child recognise risk, for example, or do they express that they feel both safe and in control? It is important to reflect their views even if they differ from yours. And exploring the child's perception with them enables us as professionals to understand how they are framing their exploitation, and this in turn will enable the most effective approach and interventions to be put into place. When exploring risk with the parent carer, do they minimise missing episodes, for example, as this will have an impact on the child's views and actions and may be increasing the risk posed to the child? Or are they taking all appropriate protective steps, and if so, is this having any impact? You will notice that you are then asked to list any relationships, peer groups, locations or settings that you think may be linked to exploitation risk. And again, as much detail as possible here, because this will enable professionals to create a safety plan and consider any immediate actions needed to increase the child's safety. Once you have completed the previous sections of the CERAF, you will come to the scoring and professional judgment boxes. Scoring is achieved simply by adding the scores from each vulnerability and indicator together. Remember, 1 point for low, medium and high risk indicators present between 3 and 6 months ago, and 5 points for current high risk indicators or those present in the last 3 months. For any child aged under 13 with at least one high risk indicator present, a further 5 points are added to the total score. You will then use all the information you have gathered, including protective factors and safety measures, and the child and parent care reviews, to assist with forming a narrative around what the child may be experiencing, and will record this in the professional judgment box using the helpful prompts as guidance. You are then asked to determine the level of risk posed to the child. You'll notice that for each risk level you are given a score guideline, and this is because your professional judgment may override a CERAF score. So you could, for example, have a CERAF score of 11, but one high risk indicator present that is significant in relation to child exploitation risk in your opinion. So this would be explained in the professional judgment box and reflected in the risk level you select, which you may believe sits in the high risk category rather than medium. So remember, the risk level is not determined by the score. The score is a guideline, and it is your professional judgment that is crucial to identifying child exploitation risk. It's important when we consider exploitation risks that we are also alert to the potential that a child might have been a victim of trafficking or modern-day slavery. So once you've stated your professional view of the level of risk posed to the child, and whether you believe the primary risk to be CCE or CSE, you'll be prompted to consider whether there are reasonable grounds to suspect the child may have been trafficked or a victim of forced labour. If there is reason to believe they have, this is a child protection issue and needs referring into the multi-agency safeguarding hub or raising with the child's social worker if one is already allocated. Together, Children's Services and Police will make a decision whether an NRM should be completed. This decision will usually be made following a strategy meeting so that all the relevant information can be gathered. Unlike a CERAF, only designated professionals are authorised to refer a potential victim of modern slavery into the NRM. For children, this is most commonly children's social care professionals or police. Details of who qualifies as a first responder are available through the following link. And as you are first asked for referrer details, you won't be able to progress with completing the NRM unless you are recognised as such. So once you've completed the CERAF, you can refer to the risk categories and associated actions alongside. You'll find this at the bottom of the CERAF document itself, and this is a useful guide to understand what action needs to be taken next. Please note that currently in Portsmouth, low, medium and high risk CERAF should be referred to MASH. In Hampshire, Isle of Wight and Southampton, only medium and high risk CERAFs require a MASH referral. Whenever a CERAF is completed for a child, it is also important that the allocated social worker or lead professional is notified and can share their views. The CERAF should be shared with them regardless of the outcome. All medium and high CERAFs are then sent to police and will be graded by them through their own processes. Sharing with police will occur either through the MASH process or by the allocated social worker. The very last bit of information on the CERAF is the link to the CERAF guidance, which includes more detail around each individual indicator. is recommended that all serifs be completed using the guidance as a reference. You'll then find email addresses for teams where you can contact someone for support or guidance in each local authority if needed. So this concludes the information included about completing the CERAF, and we will now move on to explore the Community Partnership Information Form. So the CPI form is really useful in order to enable us to gather information that helps build a picture of local issues and potential individuals or areas of concern. So as with every document around contextual safeguarding, including the CERAF, you're asked to include as much information as possible within the CPI. So names, nicknames, car details, mobile numbers, including the IMEI number of a mobile phone where possible. This form is then sent to police. Instructions for how to do this are at the top of the form, and it's then sanitised so the source cannot be identified and shared with relevant partners. So the CPI is highly valued in all 4 local authorities for its ability to develop that picture of contextual risk, and we ask all professionals to have an awareness of this form and when to complete it. More information can be found in the professionals section of the Safe for Me website or via the link here. That concludes this short presentation on the CERAF. I'd urge you to contact the relevant team in your local authority using the contact details on the CERAF itself if you have any other queries about this topic. Thank you.